Every day we tell you the latest COVID-19 numbers from the Arkansas Department of Health, but that's not the full picture, with the state admitting there are cases that are not being counted. Because we're working for you, our Susan L. Corey takes a closer look at why some COVID cases are falling through the cracks.
This is something I found out firsthand a couple months ago when I tested positive for COVID-19. To date, the state hasn't been able to give me a record showing it received my positive test result. Turns out I'm not alone, and the state hasn't figured out a solution. In a race for information, time is critical to counting every case of COVID-19.
The fax system is kind of the bane of our existence.
But the Arkansas Department of Health relies on technology that it knows isn't up to speed.
It is largely inefficient, and it comprises probably the majority of our reports that we get in.
Digital options are the preferred choice. Instead, fax machines are how the state receives thousands of COVID test results, a system that used to work, but now many see as archaic.
It really is just an outdated way of doing things.
That's creating a clash between leadership and those on the front lines who are investigating cases.
It's absolutely concerning and it's frightening.
Through their work with the Department of Health, they say they've come across hundreds of people infected with the virus who are going uncounted.
I would say well into the hundreds, and they're really probably thousands. They're nowhere in our system, nowhere. Their test result is nowhere in our system.
This person agreed to speak with us if we hid their identity. In the course of their work, they discovered a concerning disconnect in reporting between COVID testing centers and the state.
More often than not, they fax it in, and we may get the result maybe 3-4 months down the line. So those numbers aren't even counted in real time. So the numbers are skewed.
The numbers they're referring to are what the state reports every day, logging both confirmed and probable cases.
I believe our numbers are very accurate.
Dr. Mike Sema is the chief deputy epidemiologist at the Department of Health. It's his job to oversee test results. He says it takes 2 days to log most, and missed cases are the outliers.
I don't believe that it's hundreds of cases. Admittedly, that there are some cases that we come across that unfortunately they were missed.
There are a few ways he knows of where someone can be overlooked, starting with testing centers that aren't sending any results to the Department of Health. So how many places are doing that? It's more of a shade of gray. The state isn't counting, and throughout the pandemic hasn't kept tabs on which places are offering COVID tests. But what's black and white is the law. These are the rules laid out by the Department of Health for reporting diseases. They require test centers to send results to the state within 24 hours. We asked if any places were cited or fined for not reporting COVID tests, and we're told none to date.
This has just grown so exponentially. To be able to cover all of our bases is taking a lot of resources.
For him, possibly the biggest base to cover goes back to the state's fax machines, which he says were due for an upgrade long before COVID. That never happened, and now the state is stuck with a system that's being pushed to the limit.
And that is a paper form that gets sent over, and we have to manually enter it into our system.
That's a step that likely didn't happen in my case. This fax was sent hours after I tested positive. The status says okay, but I still haven't been able to get a record of me testing positive with the state. Even now, months past the 2-day processing period Dr. Sema says is average.
We meet every single week to discuss as a large group to see what it is we can do better.
One of those discussions led to an online portal. The state launched it in late October. All test centers have to do is sign up to start uploading.
And that feeds directly into our system. It really negates the need for any kind of manual data entry.
Time can only tell how it will work out and if test centers will get on board, since it's an optional service. But this one-time employee believes that faster connection could signal a turning point.
The facilities that are doing the testing, whether it's antigen or PCR, needs to be linked with the public health department, the Arkansas Department of Health, so that we can effectively contact the cases and decrease the spread.
There's also the chance it could cut down on the unknown and keep a digital footprint tracking where someone may have slipped through the cracks.
I think it certainly would be an interesting publication to look at the indirect and cascading effects of faxing reports versus electronic reports.
Don't expect that report soon. He says there's no plan to see if rising cases are linked to these reporting changes. But there is a fact he can't deny.
Unfortunately, I can't really put parameters around how many cases that are really going missed.
Fax machines aren't wired for a pandemic.
We don't know what we don't know.
The Department of Health couldn't give me the exact number of faxes it receives a day, only saying it fluctuates but is in the thousands. What's consistent is the number of employees processing those faxes. There's 6 of them, and it's been that way since the pandemic started.